Hello class, my name is Maria Ramirez and my chain quality management project is related properly follow up and test results for residents and a skilled nursing facility in a timely manner. The problem. The problem is identified is the problem is identified is that an SNF the inappropriate below of the results cause a delay in medical treatment, increased hospital readmissions, medical errors, and poor quality of care among patients. The issue identification. The World Health Organization, World Alliance for Patient Safety, has identified test result management as a priority area. In 2017, report by the U.S. Emergency Care Research Institute named poor care coordination across levels of care and test results reporting problems among their top 10 patient safety concerns for 2017. Also, the Joint Commission identified the timely reporting of the results of critical tests and diagnostic procedures as a national patient safety goal in 2005. Evidence of the quality. Communicating accurate and follow-up test results timely is an important component of prevent diagnosis errors, prevent readmissions to hospital within 30 days, having promptly the correct treatment, decrease medications errors, promote patient safety, and providing high-quality care. Another quality variance that impacts financial costs is diagnostic errors involve diagnoses that are missed, wrong, or delayed, as detected by some subsequent definitive tests or findings. Diagnostic errors or delayed treatment are some of the most important safety problems in healthcare today. It is among the most common, catastrophic, and costly or serious medical errors. One study estimates that approximately 2 in 20 USA adults will have a diagnostic error annually. Quality variance is still impacting financial costs. When a patient is readmitted to the hospital and 30 days from the skilled nursing facilities are common and preventable. They reducing the potential preventable remission is critical because these hospitalizations are known to be associated with adverse events, higher healthcare costs, and most important, harmful effects in quality of life. There is evidence that discharge to SNF with a strong link to the hospital is associated with lower readmission rates, and organizations have invested in developing high-quality networks to foster collaboration among skilled nursing facilities. However, readmission has become a crucial metric with quality in financial dimensions. Medicare patients discharged to a SNF have a 25% likelihood of readmission within 30 days. A survey of SNF readmission showed that patients feel that readmission was avoidable in 34% of cases, and that inadequate or delayed skilled nurse facility treatment contributed to the majority of the readmissions. Another issue, because they don't follow up properly test results in a skilled nursing facility, is medication error. Which one can be preventable event that may cause or lead to inappropriate medication use or patient harm. Failure to scheduling or following dose therapy levels, results for medications such as Coumadin, digoxin, vancomycin, leads to the medication discrepancy, risk for toxicity, and patient safety. 90% of patients experience at least one medication discrepancy in the transition from hospital to skilled nursing care. Quality variance regarding a poor test results and communicate with physicians. The failure to follow up pathology and medical imaging test results poses patient safety risks, which threaten the effectiveness, quality, and safety of patient care. Following the test results and communicating them to the physicians, patient will have a rapid diagnosis and the treatment is going to be adequate according to the timeline. Missed laboratories or imaging tests may result in adverse patient outcomes. That's meaning we don't provide the labs in timely manner, our patient is going to be affected in her health and going to be affected in health outcomes. What is the causes? What is the root for this? To failure to follow up lab results. So in my facility, poor test results follow-up can have a major consequences for the quality of care, including missing diagnosis and suboptimal patient outcomes. A lab of clarify about where and with whom responsibility for test follow-up should be reside. A lab of clear definitions about what are critical, unexpected, or significantly abnormal results. A systematic review report to the magnitude of test results that are not follow-up 6.8% to 62% for laboratory tests and 1.0% to 35.7% for radiology. Who affected? Who person is going to affect if we don't follow properly test results? Well, the first persons who's going to be affected is the patients or residents because they're going to affect the safety and the quality care. Also, nursing staff. Everyone in the facility, a nurse who is a nurse is going to be affected because if we don't follow test results, the patient is gonna become sicker, and there's gonna be more workload for the nurses. So the patients start being confused. Then it's the job that the nurse to assess the patient and maybe request to the doctor for any labs, any urinalysis to find out what's going with the patient. So, and also for sure the facility. I noticed my administrator, he's not happy when we admitted a patient a week ago, a Medicare patient, and they had to return to the hospital because maybe the care what we provided there was not enough to keep the resident there. So if we transfer a Medicare patient, means less reimbursements for the company. So, and there's gonna be a less patient for a census. For sure, the quality care is gonna be less. It's gonna be less star for us. For the solution I find for my problem in my facility is to reinforce education to the LVNs, because I'm the RN, I had LVNs who has the function as shared nurse in a nursing home. And we are also implement a tracking system for 2 weeks to ensure that resident labs and imaging test results are complete and follow up promptly and appropriately. So why the nurses or the LVNs, they don't follow up their labs in a timely manner? So we implement a questionnaire of 3 questions to assess if the LVNs and RNs know how to follow up laboratory results and proper follow-up. The 3 questions on the questionnaire were: what do you when you carry out a lab test imaging order? Do you have access to the lab imaging portal, or do you know where is located the lab log? Do you know how to identify what is a normal or abnormal test result? This is the 3 questions we did for our nurses in the facility, and we find something like a mostly the new grads, the LVNs, the new grads, they are no the first time working in a skilled nursing facility. Sometimes they don't know how to carry out for a lab order. This was a good tool to use it. So another implementation what we do it was reinforce education of the importance of the following labs and imaging results appropriately. Educate the nurses with writing and visual learning materials. So we bring out some statistics about costs associated with patients' readmissions to acute hospitals. Reinforce the delay of care from the patients at the risk for poor health outcomes. Another implementation was to develop a system of tracking. We do like a book, a nurse lab imaging test logbook. That means the PM nurse, because the labs come in the night time where I'm working right now. So the PM nurse will write in the laboratory log all labs that are done that day. Like for example, they're coming today, we're gonna check it. The PM nurse, they had to make sure all the labs could be done today. The EM nurse will check the lab log and review if all the labs were done or the X-rays and the results if the results came to the facility. Also, the EM nurse will analyze to the laboratory and notify the physicians and the pharmacy. So like some drugs like vancomycin, Coumadin, we got to get a new order from the physician, and after that we had to fax to the pharmacy in order to get a new dosage. Also, we need to carry out the orders, so we need to update our MariaR and schedule for the next labs it's gonna be done. So once we carry out the orders, the AM nurse, they had to mark in the lab log what labs were complete, what are pending, and what labs cannot be done, haven't done yet, because some patients refuse. So those patients, they need to be maybe try again today. And the pending, so the PM nurse, when she got there, they had to call the company and see they already had the results for the pending labs. It start the same cycle what she did before the day before. The analysis. So we do this one for 2 weeks. What is the analysis? Well, the questionnaire tool was a successful. It was a successful tool because I, I, I could identify gaps regarding carry out lab orders among the new nurses. Educating nurses about the proper follow-up of the test result was assertive. Nurses feel more comfortable identifying normal and abnormal results. So now they feel comfortable seeing what is normal and what is abnormal. The lab log book was a good implementation because the nurses, this is mostly like an narcotic book now, because now the nurses, they're accountable for to sign the book and endorse to the coming shift. So doing this reflect more control during tracking the test results. So I can say after the 2 weeks of using the lab logbook, I saw less hard copy of the lab's results or X-ray results may place in the nurse station. I remember before I saw everywhere labs results, so somebody received the labs but nobody put too much attention to follow up. Also, I noticed that some patients are there starting runaways on antibiotics treatment after the lab results they were notified to the doctor, and we already got orders to start the treatment. It was a little more faster than before. But no, everything was good. So one of the patients last week I know that she's supposed to be go to the orthopedic specialist appointment, but she lost her appointment because nobody scheduled the X-rays for her hip. So because she doesn't have update for she doesn't have any current X-ray, she missed her appointment because last time when she went to the doctors, she brought some orders about to do the X-rays to the hip, but nobody follow up. So there's some issues about lab and in imaging tests that should be scheduled at a certain time, but we're still working on that. Other aspect what I noticed was missing education for nurses who working only part-time shifts. So we need to communicate with them and that they when are working in the facility. Well, thank you so much for your time.